education and awareness program to serve healthcare workers, patients, and their caregivers. Today, we have the renowned gastroenterologist from Ahmedabad, Dr. Ankit Patel. He needs no introduction. However, I would fail my duty if I don't mention that. Dr. Ankit Patel is a leading gastro in Ahmedabad, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has with Kaizen Hospital at Ahmedabad as a senior consultant. Sir, we salute your dedication to spreading awareness related to liver health. So now I invite Dr. Ankit Patel to enlighten us on the topic.
Hello, good evening everyone, and thank you for kind words and thank you audience. So to discuss how to knock out one of the most common problem, non-alcoholic fatty liver. So as we all know, liver is the second largest organ in the human body. It is located at upper right hand portion of the abdominal cavity on top of stomach and intestine. Liver is most important organ in our body. There are a lot of important function done by liver that includes destroys the old RBC, processing of the nutrition, regulates the blood composition, produces the bile, produces protein and cholesterol, controls more than 500 metabolic processes, breakdown of alcohol and medication, and detoxification of blood. So what is non-alcoholic fatty liver disease? Basically, non-alcoholic fatty liver disease is a condition in which more than 5% neutral fat deposition in the liver not caused by alcohol use. If this disease is left untreated, it will progress to NASH, fibrosis, and subsequently cirrhosis also. So it is not a benign condition. It is a chronic progressive disease leading to life-threatening condition called liver cirrhosis. So 1 out of 4 people have NAFLD regardless of weight. And male gender has been regarded as a risk of progression to NASH and fibrosis and cirrhosis faster than the female patient. What is the natural history? If patient is obese, diabetic, dyslipidemia, hypertension, then there will be a fat deposition in the liver and it is called fatty liver. If it is left untreated, there will be a lot of inflammation in the liver. It is called non-alcoholic steatohepatitis. Subsequently, development of fibrosis and scarring. And over a 2 decade, patient will develop irreversible liver fibrosis. It is called liver cirrhosis. And subsequently, patient will develop complication and may develop hepatocellular carcinoma. So what is the difference between NAFL and NASH? NAFL means non-alcoholic fatty liver. That means only fat deposition in the liver. But NASH means apart from steatosis, there will be inflammation and scarring. So what are the common causes of NAFL? Most common cause is obesity, genetic background, food intake that includes excessive saturated fat, excessive sugar intake, physical inactivity, drug-induced fatty liver, and metabolic syndrome. So these are the common causes of NAFLD. As we all know, if patient is obese or overweight, that increases the amount of fat to constitute more than 5 to 10% and high risk of development of fatty liver and NASH. There is a strong association between the diabetes and NAFL. If patient is diabetic, 3 times increased risk of death due to cirrhosis. Subsequently, if patient is having NAFL, we should screen for diabetes because 2 to 4-fold increased risk of development of diabetes if patient is having fatty liver. What are the common symptoms of NAFLD? Unfortunately, most of the times, NAFL patient will be asymptomatic. Very rarely, patient will develop fatigue and right upper quadrant abdominal pain. But if patient is having NASH or fibrosis or cirrhosis, patient may develop cirrhosis complication like pedal edema, ascites, blood in vomiting, blood in stool, hepatic encephalopathy, and jaundice. Next, how to do diagnosis of NAFLD. Fatty liver can be a silent killer because of the progression of disease. So the diagnosis includes blood test, sonography, certain non-invasive tests like fibroscan, sometimes liver biopsy, and in a rare cases, CT or MRI also will help. Blood test. Persistent elevation of SGPT can be associated with disease progression, but there are certain limitations of SGPT. Up to 80% of NAFLD can have normal SGPT. So this is the limitation of SGPT. It will not predict the exact diagnosis and exact outcome. There are other non-invasive parameter. It includes FIB4 and NAFLD fibrosis score. These methods have established to diagnose NAFLD better than SGPT and SGOT. Most commonly and most available test is sonography of abdomen that will easily pick up the fatty liver disease. But the drawback of sonography is it cannot diagnose fibrosis or NASH. For that, we should use fibroscan, that is transient elastography. We can measure control attenuation parameter, that means quantification of steatosis, and it will also measure the liver stiffness. So this is the machine of fibroscan, and with the help of this machine, we can measure liver stiffness as well as control attenuation parameter. Another very good investigation is MRI PDFF, that is proton density fat fraction. It is the gold standard to detect the liver fat, but it is costly and not widely available. So currently, most commonly used test is fibroscan. If there is diagnostic dilemma or double etiology, we can do liver biopsy percutaneously. So this is the progression of non-alcoholic fatty liver disease. You can see here 20 to 25% patient will develop NASH. From NASH, 10 to 11% patient will develop cirrhosis. And among this, 20% of the patient will develop decompensation in the form of ascites, varicose bleed, hepatic encephalopathy. So good thing is if we detect fatty liver in early stage, at the stage of fatty liver or NASH, it is reversible. But once patient develop F3 fibrosis or liver cirrhosis, it will become irreversible. So what are the treatment modalities? Most important treatment is lifestyle modification. That includes diet and exercise, and avoid the drugs that will cause fatty liver. So most important advice be given to the patient is avoid fatty food, avoid saturated food, avoid sugar, and take a low calorie diet. Take lot of fiber, minerals, and protein. We should do daily exercise like aerobic exercise and resistance exercise. It will reverse the fatty liver as well as NASH. So if we reduce the weight 5%, it will reverse the inflammation. If we reduce weight 7%, it will reverse fibrosis. So the most important statement is we have to reduce at least 7 to 10% weight from the baseline. So we should do regular exercise, take balanced diet that will avoid saturated fat and sugar diet. as of now, there is no drug approved by FDA for the treatment of NASH except resmetirom that is recently approved for NASH with fibrosis. But there are certain other medicines like saroglitazar. The recommendation is if patient is having F2 or beyond fibrosis, so we should add saroglitazar apart from lifestyle modification. So how we can prevent the fatty liver? Limit the intake of saturated fat, take a balanced diet, avoid carbohydrate, maintain a healthy weight, quit smoking, regular exercise, avoid alcohol, and take a medicine as prescribed. Thank you.
Thank you, sir, for this wonderful talk. This has enlightened us. Now we will take the question from our audience with your permission. So there is a one common question is asked by the patient is that when we have to consult the specialist for this fatty liver disease.
If patient is having elevated SGOT, SGPT, or patient is having obesity, diabetes, and sonography suggestive of fatty liver, we should consult specialist and take as early as possible precaution.
So there is a one question is also asked by the patient is that, sir, any recommended diet and food for
We should take low calorie diet, avoid saturated fat, avoid trans fat, avoid excessive saturated sugar, take good protein, take lot of fiber and minerals. And apart from diet, most important is exercise also.
Okay. And sir, there is a one question is that, sir, if I have the fatty liver disease, it is a curable?
Yeah, fatty liver is curable. Even NASH is also curable. But if there is significant fibrosis and cirrhosis, then mostly it will become irreversible. So yes, fatty liver is reversible.
Okay, sir. Thank you. Thank you, sir. Sir, on behalf of NASH 24 by 7, I thank Dr. Ankit Patel for this lively and informative talk. As you have been
Thank you,
emphasizing
sir.
the
Thank you.
awareness for the liver health and disease, it is equally important for people affected by liver to regularly visit doctors and continue medication. With careful observation and precaution, it is possible to obtain the control of the disease. I would also thank to our
Yeah. Thank you, sir.
stay connected with NASH 24 by 7 on Facebook and take care of yourself and your family member. Thank you, sir. Thank you very much. Have a nice day.